twin daughters at the age of 15 months suffered some pretty severe allergies, and at that same time well, basically I'll just tell you what happened with them was Annie was touched by someone who had eaten a peanut butter sandwich, and within about 60 seconds she had hives head to toe. And so that was our first entry into the world of allergies. And then subsequent allergy testing suggested that she probably had allergies not only to nuts but to wheat or gluten, dairy, corn, and eggs. And so I didn't have time to cook 2 separate meals for my family, so we all eliminated those things. And within 4 days of eliminating those foods, I had 2 completely different children. The eczema that they had struggled with since they, all throughout infancy, completely resolved within 4 days and hasn't returned unless inadvertently they get one of those types of foods. And the other thing that was really interesting to me was their behavior was different. Within 4 days, I had 2 completely different children from a behavioral standpoint. They were happier, they were better natured, and I realized pretty quickly that there was definitely a connection between what I was feeding them and their mood. And at about the same time, I attended my first integrative medicine conference at the University of Wisconsin in Madison, which was put on by Dave Rakel. And the conference was focused on gut health and how gut health affects systemic illness, specifically allergies and eczema and what we call atopic disease in medicine. So it became very clear to me at that time that their gut health was very much related to the rest of their overall health. And it makes sense because about 70% of our immune system actually lies within our gut. And so if our gut is unhealthy, we start really affecting the immune system. So it just became clear to me that in order to help my daughters heal from a lot of these things, I needed to really focus on their gut health. And so we did some really simple things in addition to eliminating foods that we suspected they were sensitive to. We incorporated fish oil, which has great anti-inflammatory action, optimized their vitamin D, which is great for the immune system, and utilized probiotics, which are healthy bacteria that make up a large part of the gut. And we know probiotics are found in foods like yogurt and kefir and kimchi, and they're also now available in capsule form, and we use them quite a bit in medicine, and there's some really good data that shows that they're very helpful. But the interesting thing as I went through this journey with my children was that the healthcare team that I was working with didn't really know a lot about this, and even though I was a physician, I still felt occasionally a raised eyebrow at some of the things that I was doing, even though there was clear data in the literature to support these things. So I decided at that time that not only was I committed to my own family's health, but also wanted to be committed to learning more about this for my patients, and also to teaching this to medical students and residents in their training so that they come out to practice with more of an open mind at some of these integrative therapies that can be very helpful for health and healing. So at that time I decided to pursue my fellowship training in integrative medicine through the University of Arizona, which is Andrew Weil's program, and I completed that about a year ago, and then recently took a position with Aurora Sinai Medical Center and Aurora UW Medical Group, helping to lead integrative medicine for those 2 groups.